proposals to close Ward 36 at the RAH in Paisley for older adults, resulting in the removal of 22 beds, are proceeding despite significant opposition from NHS staff, the Unison trade union, families and patients, over the impact this could have on delayed discharge and the wider hospital. The Healthcare Improvement Scotland's guidance outlines key factors for designating a major service change, including the impact on patients and carers, changes in accessibility, public and political concern, consequences for other services and alterations in service delivery methods, each of which is clearly relevant to the closure of Ward 36. So in light of this, will the Cabinet Secretary pause this proposed closure until a full public consultation is carried out?
Cabinet Secretary.
Thank you. I thank Neil Bibby for raising an important issue, one that I also raised with NHS Greater Glasgow and Clyde and discussed with them at the recent board annual review that I was part of a couple of weeks ago. And I think, to be fair to Mr Bibby, he reflects one element of the decision but not the other in terms of what the capacity is going to be used for, because this specific ward has been used for some time for patients awaiting home care or care home placement who are otherwise medically fit for discharge. And in line with national policy on appropriately shifting the balance of care, minimising delayed discharge, the Health Board is embarking on a test of change where these resources will be directed instead to supporting hospital-at-home services in Renfrewshire. So the test will be kept under review. If successful, the potential for a longer-term change will be investigated. But I hope that puts that into greater context for Mr Bibby and his constituents, as well as the trade union representatives who I also had that discussion with, and gives them some reassurance as to the actions that have been taken by Greater Glasgow and Clyde.